It's a very good evening. Welcome to this live broadcast brought to you by Zim Papers Television Network, ZTN, in partnership with the Spotlight Initiative. Today is World Health Day, and in line with the celebrations, we are right here in studio, and we will be deliberating with the stakeholders as well as experts to help us find out the progress possibly that we've made in this sphere on this very special and important day. And gender inequality, of course, coupled with the climate crisis, is one of the greatest challenges of our time. It poses a threat on the ways of life, livelihoods themselves, health, and also safety and security, particularly for women and the girl child. And World Health Day is commemorated every year on the 7th of April to commemorate the anniversary on the founding of the World Health Organization. That's the WHO, and the joint UN-EU Spotlight Initiative is bringing us this initiative to help eliminate violence against women and girls in Zimbabwe, and is looking at this year's theme as a way to highlight the unique health-related challenges that women as well as girls encounter in the face of the climate change. Now, are we able to reignite a world where clear air, water and food are available for all, where economies are focused on health as well as well-being? To answer these and other questions, I'm joined by panelists in studio. I do have Violet Rufaro Paramoto, who is with the Innovators Against Gender-Based Violence. I also have Dr. Trevor Kanyoa, who is the WHO Zimbabwe Health and Promotional and Social Determinants. That's his portfolio. And we also have on the line joining us Sally Ncube, who is the National Coordinator with the Women's Coalition of Zimbabwe. It's a very good evening and welcome. Welcome. Welcome, Violet. Welcome,
Good
Dr.
evening, viewers.
Thank you, Sally. So to kickstart proceedings, let's hear from the head of the EU delegation as well as the ambassador to Zimbabwe. That's Timo O'Connell, as he gives us a message on this day.
Today, we celebrate World Health Day, the theme of which is Our Planet, Our Health. I would like to take this opportunity to briefly highlight the impact of climate change on women ahead of today's panel discussion. There is a Chinese saying that women hold up half of the sky. There is no way that you can manage climate change, which is the sky, without women. Climate change impacts women differently than it does men because their roles are very different. It undermines livelihoods and food security. And in many cases, it is women who put food on the table, and it is women who have to go further in drought to get water and to fetch firewood. But the international community was slow to address the relationship between gender and climate, often because of the imbalance of representation in decision-making processes. Today, we see women leading the international community to create more gender-responsive climate policies, and we also see more programs, like the Spotlight Initiative, putting women's health and well-being at the center of their activities. The EU is strongly committed to supporting gender equality and women's empowerment worldwide, and has contributed 30 million to the Spotlight Initiative in Zimbabwe with the aim of complementing the EU's long-standing and impactful Health Development Fund. Indeed, for the past decade, the EU has supported the multi-donor UN-implemented Health Development Fund for primary health care. The Health Development Fund contributed to significant reductions in maternal and child mortality, but the gains made are threatened by ongoing economic instability, climate change, and the impact of COVID-19 pandemic. Given that Zimbabwe has high maternal and child mortality rates, maintaining quality packages of care and protecting women's rights is a high priority for the EU. There is a lot of work still to be done. Early pregnancies contributed to high perinatal and maternal mortality. Between December 2019 and December 2020, maternal mortality rose by 27%. The Spotlight Initiative, on the other hand, has contributed to a reduction in sexual and gender-based violence and harmful practices through the consolidation of broad partnership with civil society, the government, the private sector, media, and development partners. But the Spotlight Initiative goes further to support women who may find themselves particularly vulnerable to the adverse effects of climate change by deploying innovative financing mechanisms which directly impacts their overall health and well-being. But women are not only the victims of climate change, but also the solution. And it is this concept that forms the basis of many of Spotlight's successful mechanisms that are designed with the vulnerable women at heart by having women from grassroots level taking part in decision making. We have a responsibility to take note of local and traditional knowledge, which is an important aspect for indigenous peoples and women at grassroots, that they are respected for what they know and for the expertise they have in trying to cope with and adapt to the issues climate change presents. The EU will continue to seek to enhance climate resilience and environmental sustainability in Zimbabwe, and will continue to do so with a gender-sensitive lens. With that, I would like to thank you for joining us in commemorating World Health Day. May we continue to support our women and the integral role they play in sustaining our planet and our health. I thank you.
All right, many thanks there to Tim O'Connell, the head of the EU delegation and also ambassador to Zimbabwe. I love the chirping birds in the background there. Did you hear that, Doc? The natural, feel of that video. And of course, talking about some of the milestones that we have made and also some of the injections that we have made deliberately to try and improve primary health care within Zimbabwe. Now we'll hear from Ms. Mia Seppo, who is the UN resident and humanitarian coordinator, as she gives us a message on World Health Day.
Good evening. It's my great pleasure to join the government of Zimbabwe and development partners to commemorate World Health Day and adding our message to those from Honorable Dr. Nioni, the Minister of Women's Affairs, Community, Small and Medium Enterprise Development, Honorable Dr. John Mangwiro, Deputy Minister of Health and Childcare, and His Excellency Timo Olkkonen, the EU Ambassador, and many others. This year's theme, Our Planet, Our Health, serves as a timely reminder of the connection between the health of the planet and our human health. Climate change is increasingly impacting people's mental health and well-being. This World Health Day represents an opportunity to discuss the urgent actions needed to keep humans and the planet healthy. Zimbabwe has not been spared from the devastating impact of climate change, with unpredictable weather patterns characterized by floods and cyclones as well as droughts. The cyclone Ida in 2019 serves as a stark reminder. So does the COVID-19 pandemic, which illustrates the interlinkages between planetary, animal, and human health. There is a need for an all-of-government and all-of-society approach to mitigate the effects of climate change and protect those vulnerable. This includes making health care available to all, leaving no one and no area behind. And this is in line with the commitment under SDG 3 on universal health coverage. The climate crisis has increased responsibilities and has particularly further burdened women and girls. In almost 2/3 of households in developing countries, women and girls are responsible for collecting water, firewood, providing food for their families and caring for the young and the aged. This is called the unpaid care burden, without which no economy would function, yet it is often underlooked and undervalued. In addition, the majority of women serve in sectors that are most likely to lead to loss of income and to unemployment when disaster strikes. And they are the frontline workers. In a nutshell, the impact of climate change on health is disproportionately felt by the most vulnerable and disadvantaged in communities. To mitigate the impact of climate change on health and other social issues, the UN in Zimbabwe, in partnership with the government and many of you, is supporting a number of joint interventions. Under the UN-EU Spotlight Initiative, a high-level political compact mobilized political will at the highest level of government leadership to guarantee equal participation of women and girls across all spheres in society. Through our efforts to build resilience, we put women at the center of our efforts to promote climate-smart agriculture, and we see women increasingly taking leadership roles at the rural community level to promote renewable energy. Through our support to the health sector, including the Health Development Fund and the Global Fund, we make sure healthcare reach all, including people living with HIV. Climate change has eroded the capacity of many developing countries to achieve sustainable, inclusive, and equitable economic growth. The UN Secretary General, Antonio Guterres, has described the planetary crisis as our #1 existential threat that needs an urgent, all-out effort to turn things around. And turning things around is urgently needed for the health of our planet and our health, including our mental health and well-being. Wishing you a fruitful discussion and a happy World Health Day. Thank you.
All right, many thanks. That's Ms. Mia Sepho, the acting UN resident and humanitarian coordinator, also touching on a number of issues that highlight on the theme for our discussion today, that we'll be talking about climate change as well as the health, the impact of health. And I think the resident coordinator, they actually talking to many of the points that are quite critical towards our thrust in as far as the SDGs are concerned. Now, today, of course, is the World Health Day, and this discussion is around that. And the government of Zimbabwe joins the rest of the world in commemorating World Health Day that is running under the theme, Our Planet, Our Health. And of course, the government of Zimbabwe did issue a statement today, the 7th of April, and it says that today the Ministry of Health and Childcare joins the rest of the world to mark World Health Day 2022. This year's theme, Our Planet, Our Health, advocates for global attention on urgent actions needed to keep humans and the planet healthy and foster a movement to create societies focused on well-being. Climate change is the single biggest health threat facing humanity, contributing to environmental risks that are killing around 13 million people every year. Zimbabwe has not been spared from the devastating impacts of climate change, with heavy rainfall characterized by floods and cyclones as well as droughts. Zimbabwe's Honorable Deputy Minister of Health and Childcare, Dr. John Mangwiro, is on record saying climate change has the potential to stall the country's development, pose a serious risk to food security, health and adaptive capacity. And our government has shown its commitment to address climate change through our National Climate Change Response Strategy, which seeks to establish specific provisions for dealing with climate change issues, understanding the extent of the threat and putting in place specific actions to manage potential impacts. This is the Deputy Minister of Health talking right there. And due to the climate change, Zimbabwe experienced Cyclone Idai in 2019, which affected more than 270,000 people, leaving an estimated 340 plus people having lost their lives, and massive destruction to infrastructure, which of course includes clinic, healthcare facilities, as well as schools, amongst others. And the country also suffered the tropical cyclones Ana, amongst other climate shocks, signaling an urgent need for all stakeholders to start conversations around climate change as well as mitigating plans. And in Zimbabwe, if not mitigated, climate change will cause average temperatures to rise by about 3 degrees before the end of this century. Annual rainfall could decline by between 5% and 18%, especially in the south, and rainfall will be more variable. This is all in the statement that was released by the Ministry of Health and Childcare. And they did highlight some of the steps that can be taken in order to reduce the impact of climate change, including transport and energy, adapting and changing to renewable energy such as solar, and not heating rooms to over 21.5 degrees, switch off lights that are not necessary, and also change health lifestyles. Tobacco is a killer and a polluter. Stop smoking, they say, and also save water and use renewable and reusable packaging, especially when it comes to plastic. So this is the the statement that is on the Ministry of Health and Childcare website. It's also there on their social media platforms. You can access it there. Moving on to today's discussion, let's come back in studio. Dr. Kanyoa, I think we did hear there from the UN resident coordinator as well as the head of the EU. They tried to unpack this for us. But someone out there could be wondering, really, is there a link really between climate change and health? Because we did hear the UN resident coordinator, the acting UN resident coordinator, saying our planet also needs to be healthy. We need to worry about its health.
Thank you, Blessing. Indeed, the link is there and it is huge. Let me start by going back to what you have just mentioned. As the World Health Organization, we are seeing that climate change is claiming around 13 million deaths annually, globally, which is huge. And one other thing that we are noting is that, in actual fact, we are witnessing even around 250,000 more deaths each year. So, which means the 13 million that we are talking about today, if not mitigated in years to come, we'll be adding at least 250,000 deaths more per year. So this is really one of the greatest challenges that we are facing in health. I will try to simplify some of the links of climate change and health. But climate change is really what is causing all these droughts that we are seeing. Recurrent droughts, they are becoming more and more. And as you know, with recurrent droughts, it means there's loss of food security. We don't produce enough food. We don't produce adequate food.
The cumulative effects.
Yes, and in turn, this leads now to malnutrition. And malnutrition itself is a condition that generally weakens the body. And in terms of a generally weakened body, you are prone to many types of infectious diseases. So you die from many other infectious diseases. We are noticing that also climate change has caused a rise in vector-borne diseases. You know, we are seeing that mosquitoes are transmitting more the diseases that they transmit, like malaria. We have conditions like dengue fever, which is not really here in Zimbabwe, but we are noticing that there are more diseases that are being transmitted by parasites because of climate change. Our water has become more unsafe, which means again we have loss of hygienic water to use, especially for cooking and generally for drinking. And this is again another habitat for infectious diseases. So again, we see that climate change in itself is bringing about these issues, which in turn tend to exacerbate what has already been there. Air pollution, for example. We are witnessing a rise in lung infections and other chronic diseases like asthma. Again, this is because of the air pollution, either through industrial waste, either through smoking, like you mentioned, you know, either through dumps that are being burnt all around the world. So these are some of the examples that I can give you. We in Zimbabwe have recently been experiencing heat waves, for example, more than we used to experience heat waves in previous decades. And with heat waves, generally it brings about issues like loss of water from the body, dehydration, which in itself is a condition which is which can be deadly enough to even claim the life of somebody, if not urgently corrected. So there are a number. I cannot be exhaustive on this program because really the links between climate change and health are very vast, but I just wanted to unpack some of them so that maybe we can better understand that there's really a link between climate change and health.
Thank you very much for that, Dr. Kanyoa. As you were highlighting there, I really then thought of the definition that I remember from earlier of health, a state of physical and mental social well-being and not just merely the absence of disease. So I think some of these issues that you're talking about really help us to understand where the link really is when it comes to climate change and health. Let me move on to Violet and Sally. Unfortunately, most of these situations that are coming up, these disasters and everything, it leaves women and girls, disproportionately affected. They are vulnerable. Can you share maybe with the audience some of the specifics on how women and girls tend to bear the brunt, of climate change and issues related to some of these disasters that we're highlighting?
Okay, so for girls and women, you realize that when disasters come or when it comes to climate change, girls and women are the ones who bear the brunt. Why? Because they are the ones who interact with the environment. Girls and women are the ones who are worried about what are we going to cook, which water are we going to use, which type of fuel are we going to use. So obviously when you're thinking of fuel, you want to look for wood. So climate change then what? Exacerbates those problems. So women at the end of the day, they are the ones who interact daily with the environment. So with the coming in of climate change, on all these changes, be it droughts, floods and everything, women and girls bear the brunt.
I think the issue of energy source, now that you mention it, also comes up to the fore. The smoke that is coming out there, the exposures that are coming out. The father is out there, trying to make ends meet, and the woman is actually exposed more. Maybe Sally, do you want to add on to some of the situations that exacerbate the effects that these climate change and disasters have on the women and girls?
Thank you. Good evening once again. So when we look at women and girls and the roles that they are expected to play in terms of the chores at home, looking for energy, long distances to look for water, we have seen women being vulnerable to gender-based violence, sexual exploitation and abuse, increased teenage pregnancies, rape and all the effects that comes with that, including forced marriages, the diseases, the premature, parenting that comes, and school dropouts coming in there. We have also seen women being, in Gokwe, there were issues about the machete gangs who would really intimidate women using machetes as they look for firewood and exploit them. And on water points, at boreholes and all that, we have seen women being exploited and girls because they are the ones who then go to long distance or they have to queue. Even in urban areas, we could see that the water tables have also shifted because of climate change. So we have seen sexual exploitation happening at that level. And then when food is not there, we have also seen that families cope differently when there's food insecurity. And women's health is complex because if you are pregnant, your needs, your sexual and reproductive health, the vulnerabilities of some of these diseases that comes out of the infections that affect women's sexual and reproductive health, and the cost. So in the long term, we have seen that we are losing women and girls due to risks where their sexual and reproductive health risks comes with climate change. The heat waves that was being spoken about and the women's hormones, depending on which age group that you are at. When you are in menopause, the hot flashes combined with heat wave even affect the productivity and the menstrual cycle and all that. So really, when we look at climate change and when it escalates to disasters and humanitarian situations, we have seen an undue pressure, stress, trauma that affects women as they try to save lives and make ends meet to keep surviving. So the livelihood is disrupted. The infrastructure is also, disrupted. Access to services are affected. And on cyclones, people use their livelihoods. They lose their identity documents. They then cannot access social protection, opportunities that do exist. So the issue of climate change across generations, women and girls have been hit hard. Then this became also hard that when you're vulnerable, them being underrepresented in decision-making positions have affected them to influence gender-responsive and women's rights responsive solutions, policies, resource allocation, and it further widens the gender inequality gap.
I think it's quite pertinent points that you raised there, Sally. Dr. Kanywa, maybe if I can come to you, looking at this gap that she is talking about arising as a result of these disasters, what can be done, to address this? What measures can we take?
Okay, thank you very much. There are a number of measures that can be taken. And I'll just highlight some of them. In fact, what I would like to do is just to highlight what we at WHO do, and also try to highlight what other people, other stakeholders can do in that. So really, in brief, what we in WHO can do about this gap is really make sure that this becomes an issue like we are doing right now. People must know that there's an issue between climate health and also in gender-based violence, the health of women, the health of children. And we must also make sure that we have the strategic guidance and information available. Now, in general, there are a lot of things that we can do to mitigate all these issues. First of all, we need to also describe our local problem. What is the burden that we are facing? What are the exact issues that women and children are facing in Zimbabwe as a result of climate change? And once we have that, we can then draw up the requisite plans and responses to whatever issues are affecting women and children.
Looking at the COVID-19 pandemic,
yes,
its impact.
Yeah.
We had reports that there were spikes in gender-based violence,
Yes.
child marriages, adolescent marriages. How significant or how big was the impact of the COVID-19 when it comes to this sphere?
The impact of COVID-19 was huge. Not only in this sphere, but in for health in general. There was decreased access to services. So talking specifically about women and gender-based violence, their ability to report was immediately diminished by the COVID-19 pandemic. The rates of abuse themselves, we have already noted that they went on a spike. They rose dramatically. In terms of accessing the services they needed after having suffered any form of abuse, again, they were limited. There was limited access to those services. So those are some of the key things that the COVID-19 pandemic did. But happy to say that, and I would like to acknowledge also our partners who are not here, UNFPA and UN Women, amongst others, with the Spotlight Initiative. These are issues that were then looked into in depth so that they could be responded to. Yes. Maybe I'll leave it at that for now.
Violet, the issues that Dr. Kanywa is highlighting obviously come to the fore. When it comes to the issue of access and limited access, did this exacerbate, the vulnerability of women and girls, exposing them maybe to extortion, especially in this time of the pandemic?
It did. Actually, what COVID-19 did was amplify the already existing problems that were there. So now women were not able to go and get their contraceptives. They were not able to travel to get their HIV treatment. So because of that, they could find means of getting such services. And also, as you highlighted, issues to do with sextortion. Women now were trading transactional sex. They were trading sex to get services. So it actually amplified what was already existing, which was a burden to most women and girls because they couldn't get what? Access to services. And as Innovators Against Gender-Based Violence, what we did now is we have 5 provinces under the Spotlight Initiative that we are operating in. So under March West, we had a group chat that was created, the Taking a Stand Against Gender-Based Violence WhatsApp platform that was created for women to come and share their experiences during what? The COVID-19, because they could not travel because of the lockdowns. So those are some of the initiatives that were done by Innovators Against Gender-Based Violence.
To try and get to the source of the problem and to try and mitigate possibly the effects of the COVID-19 during the times of the pandemic. Sally, maybe if I can come to you, maybe if you want to add on, as you do. I noticed, it just came to my mind when Violet was mentioning about the provinces. Looking at the girl child or the woman in the urban areas and someone in Mbongane there or in Dombotema or in Kotwa, how has, the situation and the risk factors been in as far as, the downstream effects of the pandemic as well as climate change on these different spheres of women?
So when we look at the Zimbabwean context, we have communities that we know that when it's rainy season, really floods affected them. And now we also had reports even from other parts of Gweru, where even in urban areas, we are beginning to have a devastating or disturbing effect that comes in with climate change and the heavy rainfalls and flooding in homes. So when we look at the women's movement in Zimbabwe, since in the 40s or 60s, there have been community-based women's clubs. And we have a government infrastructure which is decentralized, which have child protection committees in communities, youth and women community development workers who are in villages, wards, and we also have one-stop centers where aligned to clinics and hospitals with support of international partners that have been mentioned, have got access to response mechanisms for violence against women and girls. So initially, the referral pathway where people would access information, social protection, emergency health, emergency shelters, they had not been listed as essential service workers. So the women's movement did a lot of advocacy because the lockdown regulations initially had just closed and not considered service providers who respond to gender-based violence. So there was then the review of the regulations, and we were allowed to ensure that our community champions in all parts of the country, partnership with traditional leaders and community leaders and village health workers, would then also feed as response mechanisms to respond to gender-based violence affecting women and girls. Realizing that also most of the information was digital, under the coordination of World Health Organization and different clusters in the COVID-19 response task force at national, provincial, and district level, there were now collective sharing of responsibilities, utilizing what we have as community assets. So we then saw an improvement in strengthening the response mechanism. But again, how we had built our referral pathway or our institutions who respond to gender-based violence had not anticipated the spike. So our capacities by resource allocation, by the complexities of how gender-based violence was happening, we began also to promote also family-centered response mechanism. Because remember, people were not traveling. Our cultural practices also refer us to churches, to aunties, grandmothers, family mediators that had been canned. So we had also those challenges where the support mechanism traditionally that we would have, they had shifted. And people were just not coping, being at home and being used to work away from home. Now you have to share resources. There is using one gadget. There is homeschooling. There is also care work coming in. And just the stress, because with the different waves, when people were dying, it was difficult to comprehend and feel helpless because our access to housing on health matters, we cannot quarantine at home because sometimes access to housing is still an issue in some of the parts of our community. So we also saw that the pandemic created inequalities, but different partners, as shared before, are coming together to build better together and consult women in terms of what would work for them, whether it's financial inclusion. Now they recently launched the Blitz on access to documentation and access to identity documents, which had been something that had been disrupted and affecting the realization of opportunities for addressing the inequalities that had been widened.
I think you raise pertinent questions, points rather, in your contributions there, Sally. And I just as you were talking there, I'm thinking of the issues that we were picking up during the early stages of the COVID-19. I remember some households where quarantine really did not make sense because you've got so many people in a confined space and the risk really of transmission is actually quite high. This is the World Health Day. Today is the World Health Day, running under the theme Our Planet, Our Health, and this broadcast is brought to you by Zim Papers Television Network, ZTN, in partnership with the Spotlight Initiative. And we do have stakeholders in studios right now to discuss this. Dr. Kanyo, I'm coming to you. Some of the highlights that Sally actually made there talk to the progress and some of the initiatives that we're doing as a country, to try and mitigate the effects. Looking at the progress that we've made in order to, ensure gender equality and also, mitigating some of the challenges in light of COVID-19. Have we not seen a shift possibly in trying to focus maybe on COVID-19 at the expense of some of the milestones and achievements that we've done in ensuring that we improve primary health care, be it TB, malaria, tuberculosis, all those milestones that we had made, even in HIV and AIDS?
Yes, thank you, Blessing. I think we were a bit lucky this time around when COVID-19 came, because we also had another problem of Ebola, mainly in West Africa and in Central Africa. And during that time, really, we tended to focus a lot on the Ebola and forgot everything else. And as a result, when we looked back, we had lost more people from other causes than the Ebola. So this time around, when COVID-19 came, we were a bit wiser. And in fact, every country, every government had then another pillar of ensuring that there are continued essential health services. At least there was a deliberate effort to make sure that whilst we responded to COVID-19, we also responded to the others. But needless to say, even in that situation, when we then looked at our information, the data that was coming in, we still noted that though we had made our plans to ensure that other services are provided, still there was diminished access to care. comparing the years of COVID 2020, 2021, 2022 to the previous years, we saw that, yes, we had made an effort, but still more needed to be done, which resulted in innovations, more innovations. I can just give examples in broad. For example, for HIV, we came up with a multi-month dispensing of drugs. Instead of getting your medicines monthly, you would then get your medicines either for 3 months or for 6 months. The same for family planning commodities and so forth. To try and mitigate this issue of us being in the mode of responding to COVID-19. Yes, the Ministry of Health itself also took on board other initiatives like expanded outreach services. You know, where usually teams used to go out to just to vaccinate, to immunize children, they added more services onto it. Instead of just going out to vaccinate, then they would carry with them maybe family planning commodities, they would carry with them maybe medicines for other chronic illnesses like diabetes, like hypertension. So efforts were being made. We were happy at least that we were aware. But like I mentioned, when we looked at it, we were still not up there where we wanted to be, despite those efforts. So there were other issues that also contributed to that, issues of the lockdown mechanisms and so forth. But yes, we were aware of such a potential danger.
Violet, maybe if you can give us some of the measures and interventions that you're taking as health and gender promoting groups, you know, to actually advocate and mitigate for the disproportionate effects that are coming out of the COVID-19 pandemic, as well as this climate change that we're talking about.
Okay, thank you. So as Innovators Against Gender-Based Violence, as I highlighted, we are in 5 provinces. So we are in Harare, March Central, Manicaland, Matabeleland, and Marsh West. So each province has a thrust on a certain program that they are doing to try and curb gender-based violence, especially during the COVID-19 pandemic. So in Manicaland, we have the Peace Heart model, where we are saying to reduce gender-based violence, people have to come up. It's a community-based approach, which is participatory, where people come to try and solve issues amicably. So what they do, they go at a certain place, maybe a hut. Then the community leaders come, and those who are in disagreement, be it a husband or wife, they come together, then they try to solve their issues. Then in Harare, because we then observed that GBV is also on the rise, even in public spaces, even during the COVID-19, for those who were mobile, GBV was on the rise. So what Harare province did, they started a campaign, the She Matters campaign, where we're saying women have to be safe in their spaces, because women are not safe in public spaces. So there was a safe market that was launched in Epworth, which was a start for starters for women to be safe in the public spaces. So those are some of the initiatives. And we also have the He for She campaign. It's a global campaign, but the Matabeleland province actually adopted that campaign to try and make men more, understand women more, so that there will be equality. Because with equality, it means we are going to be having a healthier nation, a wealthier nation, which is more productive. So if you address equality issues, then I guess all the other issues that come with health and climate change are addressed if we address the equality issue. So those are some of the initiatives that are being done in some of the provinces.
Oh, brilliant. Okay, Sally, if I can come to you, looking at some of the initiatives that you know, Violet is talking about, I think the issue of buy-in is quite critical. I see that their approach is to try and involve, you know, these affected communities. How far are we, or how are we doing in as far as, you know, implementing and putting in place detection mechanisms that can actually cascade and collate feedback especially from these marginalized groups, to get their feedback in as far as how they're doing and some of the, recommendations that they could be putting forward?
So I would say we have a working group on COVID-19 response, which have a network of community-based reporting mechanism, which is anchored on best practices on safeguarding vulnerable populations, whether they are women, girls, men, and boys. So what happens is that there are platforms where for differently literate communities or marginalized communities who cannot utilize technology, there are community-based forums that are deliberate for feedback. So Women's Coalition of Zimbabwe releases every day a situation analysis report, which then is collecting the data from communities and then putting in recommendations to relevant duty bearers and then facilitating interactions. Then some of the best practices that are happening facilitate learning platforms for people to share how they are coping and responding. So interestingly, we have also begun to see our tertiary institutions, private sector, beginning to locally produce some of the essential, masks, sanitizers which started also to build our expertise and reduce cost and be sustainable in the COVID-19 response. We also were tracking conflicts that were emerging as a result of climate change, whether it's disaster, the humanitarian context that was coming in during COVID-19 between the health workers and the government. And we would also play our mediatory role. We would also reach out to ensure that the labor rights of health workers and their concerns were also taken into consideration by the government as an employer to create an enabling environment for health workers, because they will always be on the front line, and most of them are women. So there was advocacy work around that. And then on other issues, it took time for us to also reflect to say, when we talk about access to health, what does access mean for persons with disabilities, for marginalized communities? What do we need to rethink in terms of influencing the budget-making process? So there was also an area where we saw strengthening our capacities and community capacities to participate in budget consultations. And we have seen a significant improvement on the national budget presented by the Ministry of Finance, where we could see an increase in agriculture, because that's what we were lobbying for. In health, we are not yet there on the 15% in line with Abuja Declaration, but we can see that there are significant progress being made. Then harnessing the different expertise from different sectors. We have seen the opening up. Traditionally, when it's a healthy issue, it used to be just doctors and medical practitioners only, and pharmaceuticals. So we could see also issues of prices, the escalation, the unreasonable cost on tests, and even for digital platforms, because for those who are working online, the telecommunication companies were unreasonably milking citizens. So there was an issue of engaging them on tariffs, data costs, which is still a struggle even up to now.
All right, thank you so much, Sally. We apologize for a slight feedback. I'm sure it could be one or two gadgets that could be close to the microphone there. Dr. Kanyowa, as we head towards a close, points that were raised by Sally there, community-based reporting, and she's talking about lobbying and budget. what is your assessment, first of all, on the integrated effort that is happening towards these organizations? And then secondly, your assessment maybe of the legislative and institutional framework provisions that we have made as a country so far in as far as addressing these issues.
Thank you. So I'll start off with the efforts that are being made. And I think obviously you can tell from the contributions that are being made here that as a country we are moving in the right direction. There is a positive view on how to tackle these problems in partnerships and in coordination. The country itself also has a number of policies and legislations. But what I think is very important is the enforcement of these policies and legislations. Mm-hmm. Some of these are bound by international declarations, but as long as we do not police them properly, then we are doing ourselves a disservice. We need to adhere strictly to those policies. We see great work being done, for example, by the Environmental Management Authority on these issues. So we need to look at that. The issues of, I think one issue also that we need to highlight is we need to avail the needed resources, especially guided by the, by the Paris Agreement, that it is the government's wishes that are put ahead of any financial relationship rather than the donors. That will then give the government the power to focus on its policing effect. The partnerships have grown. One of the speakers, I think, I don't remember who was speaking of, we used to think of doctors as the only ones in health. Mm-hmm. But if you look at how we are tackling the issues of climate change, it's all across the board. All the partners, the industrialists, the line ministries, civil society organizations, United Nations organizations, even individuals at an individual level are being involved in one way or the other to improve the issue of our climate. Yes, we still have some challenges with community reporting, but again, because of innovations that are coming on board, especially where we are now using digital information, I see us moving in a better direction. We now have better community information coming up to the national levels of our relevant line ministries.
Wonderful information coming through, obviously, in a timeless manner will help us to timelessly come up with interventions. And I think the cross-cutting approach that you're talking about also comes to the fore. And looking at the bigger picture, really, we are signatories of the Paris Agreement and all these international conventions, so we really have to play ball. And it takes you and me to actually come up with the solutions that will be talking to the challenges that we actually have. As we round up, maybe I can ask the panelists to give us their closing submissions. What do you want to leave the viewers with this evening? Violet, starting with you.
Okay, thank you. I believe the youth are supposed to be parts of the development trajectory in Zimbabwe, and there should be deliberate attempts by the government and civil society to integrate the youth. And when it comes to climate change, the effects, if you look at the demographics of Zimbabwe, you realize that we have more youths than any other age group. So I believe the youth have to be part and parcel of the development trajectory, and also they're supposed to be availed funds for them to start projects, so that they are because of the unemployment problem that we have, to start projects, sustainable projects, I say. So I think youth are supposed to be part of development. Mm-hmm.
That is crystal clear. Let me come to you, Sally, as you give us your closing contributions.
Thank you. So women and girls remain central to sustainable solutions when it comes to sustainable health our climate, our planet, and sustainable development broadly. So we appreciate development investments that has been made at accelerated rate through the Spotlight Initiative and the Team Europe initiative that was launched. So it's refreshing to see that there is increased programming, political will, policies and commitment and structures embracing women and girls' rights to ensure that we leave no one behind. And then in commemoration of World Health Day, I want to also appreciate the World Health Organization for expertise and encourage people to go to the website, because I actually read and was inspired by the guidance that are showing different stakeholders on what we can do to ensure that we play our part and ensure that we contribute to upholding, promoting, and protecting women and girls' rights as it relates to our health and our planet sustainably. Thank you.
Thank you so much, Sally. A clarion call, really, and a call to action as well as a pum-pum to the World Health Organization. Dr. Kanyoa, I'll give you this opportunity to give us your remarks.
Thank you very much. What I would like to say is that climate change is real. Climate change is affecting adversely our health. What we are witnessing today is a result of the mistakes that we made decades ago. If we continue to make those mistakes today, decades to come, our children and their children are going to experience even worse events. And more pertinent is that whilst the general population may suffer these health consequences, they are exacerbated in women and they are exacerbated in children for a number of reasons. For a number of biological reasons, which make them at certain moments of their lives less immune, for a number of reasons, which might include cultural issues, which might include the issue of how they get income. There are limitations in terms of getting income. Issues which include they are usually our largest workforce, whether in the home, is the woman who's going to the garden, is the woman who's waking up in the morning to be bitten by these mosquitoes, whether in our industries and in our facilities. Give you an example of health where I work, women are the largest force, and they are therefore the more at risk as compared to their male counterparts. So climate change is real. It affects our health, and it affects more so our women and our children.
I thought you were going to say the women is bitten by the snake, but you said mosquitoes. We appreciate our women out there for the roles that they played, many women that are helping in the upkeep. And we are in the United Nations Decade of Action. And despite all the challenges that are coming up, all the disasters, we still have our targets in as far as our Sustainable Development Goals are concerned, so that we meet those targets that we have for 2030. And many thanks, of course, to the Spotlight Initiative for bringing us this program. It is the World Day commemorations today, our planet, our health, and we were discussing in studio. I have to thank my panelists, Dr. Trevor Kanyoa, who is with the WHO Zimbabwe under the portfolio of health promotion and social determinants, Sally Ncube, who was joining us virtually, the National Coordinator for Women's Coalition in Zimbabwe, and also Violet Rufarum Paramoto, who is with the Innovators Against Gender-Based Violence. Thank you so much for your contributions, gentlemen and ladies. Thank you so much for your contributions. My name is Blessing Manazi. It has been an absolute pleasure, and we did hear, of course, the headmen hold the sky, and it is your role, it is our role. We all have to play together so that we are in tandem with our targets for the Sustainable Development Goals. Iweneni Tinebasa. It's a very good evening, and enjoy your evening.